have you back on camera here at
Thank you.
the AAO 2016. Since we last spoke about a year ago, you were telling us about some very important programs that were emerging for low vision individuals.
I think what's interesting, perhaps to your audience, is where we're going with visual neuroprosthetic devices, since the world of the blind and the world of driving blind are merging. So a few weeks ago, we held a World Research Congress in Detroit on the development of devices to put in the eye or the brain to allow many people who are now blind to recover some level of useful vision. And obviously we're not at the point yet where those people will drive, but we are at the point we're now seeing 5-year results from one of the devices, a prototypical device from Second Sight in California, which establishes the fact that such devices or neuroprosthetics will in the future allow a great deal of independence to people who are now dependent. So the world of autonomous driving and the world of blind people are beginning to merge. I think what was interesting several weeks ago at the Eye on the Chip was the almost explosive growth around the world of investigators working on devices both in the brain and in the eye to allow some level of useful vision. So I think what's important for your audience to understand is that we are really at the dawn of a new era where electronic devices in the brain, in the eye, in the spinal cord will give useful technologies to people who have tremendous loss of function. And I think that what was interesting about the recent The Eye on the Chip was how explosive that growth is. I think it's interesting that it's growing so fast now that the Eye on the Chip, which has been held every 2 years, this weekend at the Academy, a group of us met and will now be holding it, that same Congress again in 2017 that we held in 2016, simply because there is so much to cover. So many new devices which are so much more sophisticated, so many more countries that are working on vision for the blind, so many different technologies of artificial vision that we will be holding it annually apparently from now on.
So tell us about the lead candidates in your mind. You obviously are aware of all of these candidates. Which are the most promising ones?
At this point, the United States Food and Drug Administration has only allowed the implantation of such devices in patients who have far advanced retinitis pigmentosa. That is a genetic defect in which the rods and the cones generally die. Those patients often are young men and women who have excellent vision until their teens or 20s and then begin losing their peripheral vision. And by their 40s, 50s, or 60s, often they're totally blind. That is the group of patients that we're now allowed to use these devices in, that is in the United States. Those regulations may differ a little bit in Europe or in the Orient, but that's who we're implanting here in the United States.
Turning to the specific technologies, which do you believe holds the greatest short-term promise?
I used to think that it was the visual neuroprosthetic devices, but I'm not so sure today that it isn't ultimately going to be some sort of a hybrid device. And this, a hybrid device probably will involve the utilization of adult stem cells, the utilization of much finer nano wires than we are now able to build, a greater sophistication in our understanding of the brain. After all, the retina is just a portion of the brain put out on a stalk we call the optic nerve. So the more that people like Shelley Fried and others tell us about what the ganglion cells are doing in the eye, the better we understand that, and the better we understand nanoelectronics, I think our idea of what the most promising device might be will change. Surely the visual neuroprosthetic devices, let's give you an example. I think the Argus 2 has 60 microelectrodes. Well, the Pixium device in Paris has 150 microelectrodes, and the German device has 1,500 microelectrodes. So there's this great flux over how many microelectrodes we can put in a microelectrode array, and how can we hook them all up in such a way that the device can be a learning device. So if it sees an object imprecisely, it can straighten that out to what the brain really wants to see. And maybe we'll be doing that with nanoelectronic devices, or maybe we'll be doing that with infusions of adult stem cells. And certainly there are countries, Israel being one, in which that hybridization is promising.
So when we look at the issue of the size of the microarray, the density of the microarray,
Good.
you see an exponential growth in that, similar to what we've seen in transistors, or is there a structural limitation given the fact that you've got to integrate it with the visual cortex?
I used to think that the answer was the more microelectrodes that we could cram into the array, the higher the resolution is going to be. But I'm not sure that that's a linear relationship. And it may well be that increased resolution depends on a better understanding of the ganglion cells themselves. We know that there are many forms of ganglion cells, but our knowledge of exactly what each of those different types is capable of achieving is imprecise. So it seems now, just to answer your question, and I'm certainly not a world leader in this, but from what I heard at the Eye and the Chip, it seems now that the better we understand the brain itself, and the better that we understand the advances in nanoelectronics, the better our chances of having increased resolution.
So the question then is where to do the connectivity. Is the connectivity at the level of the optic nerve, or is it at the level of the visual cortex?
Well,
and what is optimal in terms of resolution and connectivity?
Sure, and the world is totally divided on that. If you look at the work of Rosenfeld in Australia, or Phil Troik in Chicago, or Eduardo Fernandez in Spain, they are totally committed to putting these devices in the cortex. And they have some very exciting work that would suggest that they may be right, so that I think the rest of us are holding off any decision. I don't know for sure whether the device ought to be, say, in the eye. Should it be in the retina, on the retina, behind the retina, in the suprachoroidal space? Should it be wrapped around the optic nerve? Should it be in the lateral geniculate system? Or should it be in the visual cortex? I think the school is still out on that. And in answer to your question, if you attend the Eye and the Chip, if you attend it next September, you'll notice that these wonderful scientists all over the world are working together, but they have very strong opinions on what the future is going to be.
But as a helicopter view, because you're a world expert, you follow this field very, very closely, if you were to do a meta-analysis, where do you think the greatest emphasis would be in terms of placement right now?
Well, I think that the ganglion cells of the retina at this point are the most promising because we can study them most easily. It's not just that we can look in and see the device with an ophthalmoscope. It's that with OCT and with very sophisticated electronic studies of what the retina is doing, we probably can gather more information more easily there than we can from a device wrapped around the optic nerve or in the brain itself. That's not to say that I think Fernandez and Troik and the rest of the cortical people ought to stop their work. I don't believe that at all. We have a good population of severely ruined young people who have come back from Iraq and Afghanistan with no eyes. Obviously, those people can't have a device on the retina. It's got to be in the visual cortex. So I'm directly answering your question, but I don't want you to think that the cortical people ought to hang up their work. I want them to continue also.
So there'll probably be a clinical role then for devices that connect at multiple levels. For certain individuals, such as people who are injured, they've lost the optic nerve, that would obviously have to be a cortical connectivity. But in other individuals, a more proximal and a more forward retinal connectivity.
That's absolutely true. Right. And I think that the more we learn about the brain itself, and we really, I guess, I don't mean this to be demeaning, but we really have a great deal to learn about what the cells of the brain are doing. I'll give you an example. I'm sitting here, I'm a conscious person, but a few hours ago I was unconscious, right? But I don't know the difference in the brain between when I was awake and when I was asleep. We don't understand consciousness. We don't understand the locked-in syndrome. We don't understand so much about the brain that the people who are working in that area, I think whether they're using the ganglion cells of the retina or whether they're using the optic nerve or the brain itself, that's where the advances are going to come.
In neurology, there's been a tremendous amount of emphasis and interest and work done on functional MRI.
Right.
In order to get a map of what's happening in the cortex in response to visual stimuli, auditory stimuli. With regard to the lab, the eye on the chip, are these investigators also incorporating functional MRI into their studies?
Yes, absolutely. Absolutely. Right. Because functional MRI simply allows us to have a finer knowledge of what's happening than we had with MRI up until fMRI. Oh, absolutely. That's one of the electronic or electrical technologies that I was addressing earlier in this discussion, is that with those technologies, we are learning so much more about the brain. I've got a grandson in medical school and another one in an MD PhD program in neuroprosthetics. I'm very jealous of them because the world that's coming is just so exciting. So very, very exciting.
So thank you ever so much I think you've brought so much insight and so much perspective and so much impetus to this field. So we thank you and we congratulate you for your efforts and we look forward to following them as you go forward.
We'd love to have you at the Eye on the Chip next September. I think you'd enjoy it greatly.